Hello and welcome to Top Form. And we're coming to you from the national TV Doordarshan. This time we're going to talk about central government health scheme. The central government health scheme has been there in place for the last 6 decades, and it has been providing comprehensive medical care to the central government employees and pensioners under the scheme. And in fact, CGHS caters to the healthcare needs of eligible beneficiaries, covering all 4 pillars of the democratic setup in India: the legislature, the judiciary, executive, and the press as well. So this time we have with us in the studio Dr. Nungsang Temjan, Chief Medical Officer, CGHS Kohima, to talk to us and bring more light on this health scheme with us here in the studio. Doctor, thank you for your time and welcome to Doordarshan.
Thank you, Mr. Vincent. It's a pleasure to be here.
Well, we will jump straight to the questions that we have all lined up here. So many, and I hope we will be able to get through to all of these questions. Doctor, to begin with, what is CGHS?
Okay. So, CGHS is abbreviated as Central Government Health Scheme. So, it was established in 1954, initially in the metros, but now it has spread to more than 77 cities, mainly large cities and capitals all over the country.
I see.
So, we cater comprehensive health care to all beneficiaries who are eligible. Okay, so they are usually central government employees and their dependents, and central government pensioners, and also, like you said earlier, also we cater to the MPs, ex-MPs, ex-governors,
I see.
Supreme Court judges, ex-judges also,
I see.
and so many other categories. There are around 30 plus categories there.
I see.
So basic, but mainly these are the ones I've mentioned.
So, Doctor, who are all eligible to get the services or facilities of CGHS?
Yeah. So CGHS is, like I said, exclusively for central government serving employees and pensioners also, and their dependents who are the family, usually the family members, and also the other categories which I have mentioned, like ex-governors, MPs, ex-MPs, ex-Vice President of India,
I see.
and even some journalists, accredited journalists also. And like I said, there are 30, 40 categories under that.
So basically, as per the introduction that I gave, the legislature,
Yes.
judiciary, executive,
Yes.
and the press. Well, that's interesting to note. And is this scheme free, or can people enjoy the benefits of this scheme free of cost, or is there a payment? And if there is a payment, then what is the rate of payment or contribution that one has to give to enjoy these facilities?
So it is a contributory health scheme.
Uh-huh.
So there's a various modes of payment. So we have basically 2 categories of patients. They are called serving or pensioners. Serving people, they are deducted from the salary every month. And pensioners, they make a payment, one-time payment or yearly payment.
I see.
So the rate of payment, it ranges from 250 rupees to 1,000 rupees per month, depending on your pay level
I see.
for serving beneficiaries. And also for the pensioners also, they make one-time payment. It depends on their pay also, how much their pay was, and they make a payment of 10 years, and they get the scheme benefits for lifetime.
Oh,
For themselves and their family, their dependents for lifetime.
acha.
Or else they have another option of paying every month, but most of them, they go for this lifetime option.
I see. I think that's a wiser choice.
Yeah, wiser choice.
Yes. So, okay, viewers, we are talking about central government health scheme. This, as doctor has, informed, it is abbreviated as CGHS. NHS. So this scheme, idu scheme do kon central government laga kam kuri ase idu khan tate bara pai lobo aro kon tate bara kam kuri kine retired hoise pension loi ase idu khan bi pabo aro itu kam kura manu laga dependent khan bi pabo pensioners dependent bi pabo na
dependent bi pabo
to itu laga scheme laga opor de আজি Dr. Nungsang Temjan aigine mohan la kotha ko ase aro itu scheme tu pakka central government laga aro free bit tu nohoy holbi ek hisab te tu bishi free insurance ekta nisne ho jese
yes correct
apni olop contribute kurubo aro medical check up kan ki hobo mohan aro bishi hudibo idu han sob pai jobo doctor idu CGHS center to hospital ko na ki ko idu Kohima de thaki ase apni ahise dusra district te ase na nai
so previously mohan la to dispensary mati daise now it the government nomenclature change it korina it the wellness center koi
wellness center
yeah that is the main place so presently Kohima te Asimwan Nagaland and we cater only to Kohima. That is also Kohima town, not the whole Kohima district.
I see. Oh, so central government health scheme itia available Nagaland de available thakado khali Kohima town de ase.
Kohima town de ase.
To jodi kumba manu phek te ase aro tai yada service lobole parbo na na parbo.
Itu duita category ase so moi elaborate kori dibo. Mola coverage to 5 kilometer radius ase and this it is applicable only for serving employees pensioners kanimdo it doesn't matter you can be posted anywhere you can be living anywhere you can apply for CGHS anywhere not only Kohima also you can apply in Delhi also in Guwahati also apni kuti apply kole munja se aparibo pensioners kanimdo
to jodi central government laga structure da kam kura manu du Kohima de ase gule du Kohima thaka manu Kohima town de thaka manu du ahigine apnar la wellness center de service lobole paribo aro phek idu khan de thaga Dimapur idu dur de 5 kilometer ra bishi hoje idu khan du etia du na paribo hole pensioners khan du sob ahigine lobole paribo acha Doctor apnar laga wellness center to Kohima de kon du jaga de ase
acha mola wellness center to it's in Meralitsa colony it's opposite to Paramedical Training Institute just near the CMO office and our timings I'll explain the timings
yeah sure
we open at 7:30 in the morning and we close at 2 p.m. sorry
2 p.m.
we close kore and we work 6 days a week Monday to Saturday including second Saturday also we open and we are closed only on Sundays and gazetted holidays.
I see so mohan laga CGHS now doctor public kan ahigina service lobole paru na parubo central government kam nokura kan
yeah general public can we give emergency services we never refuse them but other services like dawai kan dia kan money on the dibuli na pare
acha
only be if they come whatever emergency services we can give we give
acha doctor check up to at least to
yes we check up
so for those people CGHS laga wellness center do thik amar Meralitsa bishi manu na jane gine thakile paramedical colony ena bi koi thake tate mohan chief medical officer aro itu mohan state government laga chief medical officer office samne de hai wellness center ase aro mohan Nagaland de 7:30 the office khula to komti hobo bishi khushi ase 7:30 to 2 p.m. Doctor service available thake emergency service kan lage gola ahibole paribo and any other central government service te kam kura kan aro itu beneficiary kan tahan ana holedu you can go there aro jagine itu service lobole paribo itu bishi important ekta hoise timing 7:30 to 2 Monday to Saturday holiday government holiday idu kan thaga dem de do chuti sob manubi aro Sunday chuti doctor facilities ki pai apnar wellness center yate Kohima de
na so Kohima laga moi koi dibo Kohima di mon OPD services di. So moi doctor as a doctor moi that whatever I can treat moi treat kuna we can pharmacy bi thake. So pharmacy where we give medicines for free. Whatever medicines is available, we have variety of medicines, very good quality medicines. In fact, well tested medicines kan thake. So it won't di thake. And normal other first aid khan, BP check kora khan, kumba basic blood sugar testing khan kumba kora thake. Or if I cannot treat the patient or if I feel patient to dusra doctor log jabo gole moi to referral services khan kore de. And mohan utate also reimbursement khan abi mon bra side de. And more or less mon office to administrative office nisna be ase because it's another CGHS city, so mon card buna khan laga office la kam khan it won't be kore de. So these are the basic ones, main ones I should say.
So basically doctor ra checkup bi dibo aro dawai bi pabo. So I think itu pra aro ki lage mo khan holibi itu aro ekta remember kurule lage kwa do itu do central government employees khan karne aro itu beneficiaries khan karne itu karne ekta hudibula age det babi thaisile itu compulsory tangka pra kati loi niki.
Yes, central government employees kanto serving kanto as long as the central government CGHS covered area that it's a compulsory scheme. They have to be included in that. Our pensioners kanim day, it's like this. Pensioners they're given by Government of India 2 health services. One is called fixed medical allowance and another is CGHS. So they can opt for which one. Kun CGHS covered area is settled kuna se. They are supposed to avail CGHS and not claim for fixed medical allowance. They can, if they don't go for CGHS, they cannot even get fixed medical allowance also. But if they are out of a CGHS covered area, they can go for whichever they want. Either CGHS or fixed medical allowance.
Now, itu beneficiary hobole karne kenega apply kurubo?
Serving khanim to the true office I will like the application and application to online as very easy. It's 1 or 2 pages, very easy application fill up. Mola website designer, it's called www.cghs.nic.in. Uda designer the steps are given how to download or fill up the form.
Matlab online de sob
online yes is everything.
To yade itia bachala kotha nisna hoise aro bishi hudibolo man ase to stupid questions kan bi hudibo de to itia for example Doordarshan's idu central government laga ase to tankha do automatically kati ase to ta khan idu apply kura nai gole to staff kan do nijer loss hoise
nijor loss itu to ine ko bule wala bobo because regardless of ta khan apply kori nuklibe office par kati lage that's the rule. Because in future ta khan kiba hoishile to office will be responsible. So ta la HOD la it's their HOD's matha de jaye to it's they should once they come into a CGHS covered area they have to be the deduction has to be made from the salary.
So mohan sob manu central government employees scheme khan central government employees khan within the Kohima town de thaka khan ene to tangka kati ase aro apply kura na gole loss aro apnar apply kurise gole do online de ase sob easy hoise mohan shopping kura nisna hobo to idu apply kurise gole apnar akla lab nohoy gina apnar laga dependent kan bi lab aro apnar idu khobor etia doctor bra janai dia nisna itu dusra manu kebi koi dise gole aro bi dangor kotha itu bal na. So doctor idu apply kurise gole do apply kuri loise to kiba documents no le kiba ID ena kan pawo neki?
Yes, mohan once they apply mohan break the form paper ekta di that it's a acknowledgement slip nishna to apply kurise. Holibi government has made it very easy because mohan plastic card kuna ekta thage which is used in when we go to other hospitals for treatment. We have something called impanel hospitals. Utati lagi thake. And when you come to a wellness center, you are supposed to bring this plastic card. Holibi, since it takes time, to government has made it very easy. So there are various ways we can get this ID card. One government of India DigiLocker kuna ekta khulina ase an app where you can download this one also CGHS card. Aro this CGHS card which is downloaded in DigiLocker is as good as the physical card. Every service will be provided. Not only CGHS card, driving licenses, ki government laga Aadhaar card concept, so you can download in DigiLocker. It's a very good app. I use it also. Very safe, very good app.
We try
We have developed our own app also. It's called My CGHS. Google Play to paijabo. Right now it's only in Android. Udadibi you can download the card also, or you can download the card from our website, take a color printout, laminate it, and use it as your plastic card. So till the physical card comes, you can use it, and even after the physical card comes, also you can use it.
Makes everything very easy.
Very easy. It's very easy.
Client friendly. Doctor, apnar empaneled hospitals kana koi thai cha. Mohan Kohima debi empaneled hospitals kan thake negi.
Unfortunately, Mohan empaneled hospital nai. If empaneled hospital thaila, our range of services are very good, and I should say that range of services provided by CGHS with an empaneled hospital is unmatched, because it's a very, very cheap. Patients don't spend so much. But unfortunately, we don't have in Kohima, but in most of the metros, starting from Guwahati onwards, there are empaneled hospitals. Shillong dibi ase, Guwahati there are around 6, 7, 8 hoshi empaneled hospitals, and all the big cities, Delhi, Bangalore, kanti empaneled hospitals ase.
So doctor, apnar yate pura kamba refer kurise Guwahati de paribo na paribo?
Itya government ba easier bunai dishe. Earlier, olop to difficult thakise, out of state treatment jao lagi, they had to go through state board employees. But now, especially for pensioners, in his job once I refer pensioners kando, they can go to any wellness center, empaneled hospitals across the country. Wherever there is empaneled hospital, they don't need any extra special permission. Only be for serving people. I refer them for consultation. They have to take administrative permission from the office that they are going like this. Office office lagi. But my referral is valid all over the country.
I see. So important signature ekta ase tate.
Eni hoy jade.
Idu jani kine rakhibole lage. Doctor, mohan dependent koi na. To mohan dependency line to alag thake.
Yes.
Tade olop dependence kan beneficiary la dependence kan olop explain kuri dibo.
Beneficiary dependent kan to ininga se spouse, husband or wife, and your children. Children do mota or maiki do alag lop category ase. Mota kan do up to the age of 25 take ase. Or if they're disabled beyond 25 also, they can be your dependent. If you have a daughter beyond the age of also 25 also, they can be dependent. Only if they start earning or they get married before 25 also, then they're no longer your dependent. And your parents, if they are unemployed or if they are not earning from their own way, our income criteria if they are earning less than 9,000 in a hospital, they are your dependents. And your brother and sister also are also your dependents. There are many others also, like stepchildren can be brothers and sisters can be as your daughter, your sister, till she starts earning or get married, she can be your dependent if she's not dependent on anyone. And your brother till he attains maturity, that is 18 years.
18 years. So dependent laga rules to alag so dependence to facility avail group chances to bishi dangor khuli kine rakhi disen na.
Yes.
Etu to bishi bal khobor ekta hoise. Doctor, yate mohan ki koy central health scheme koi na CGHS itu scheme tu aro central government employees kan la facilities alag pa itu olop alag kiba asne ki
yes mohan CGHS to mohan basically it's limited to only the central government employees only and the pensioners kwanina na only central schemes too, it can be even for state also and for central government also. So in that way it's different. This is specifically the small group of people,
like a special health scheme only for central government
employees and pensioners.
That includes you?
Yes, that includes me also. I'm also a beneficiary of that.
Doctor, এতিয়া অলপ ডাইভাৰ্সন আৰু হৈ যায় আছে হলে বি কিউৰিয়ছিটি তো বেছি হৈছে আৰু মই নিজনা কিউৰিয়াছ ভিউৱাৰ্ছ কাম বি বেছি থাকিব তো আপোনাৰ তো Directorate of Health and Family Welfare Nagaland bra deputation আহিছে না আপোনাৰ লা সার্ভিস সিস্টেম হে আলাগ আছে
মোলা সার্ভিস সিস্টেমে আলাগ আছে সো মই তো থ্ৰু UPSC আইছে we are called Central Health Services তো মই 2008 তে গুছিছে and Delhi দি পোস্ট বেছি দি থাকিনা ইয়াতে আইছে আৰু 2015 দি গুৱাহাটী আহিনা আৰু 2016 দি কইমা আহিনা সেট আপ It was the first time Kohima the CGHS set up Kodashi, so I was setting it up. Then 2017 in one inaugurate Kurina function Kura Shurushi.
Acha. Central Health Services.
Yes.
And that is UPSC exam bra
UPSC, yes.
अच्छा तो मोहन इतिया NPSC exam bra through Kurigine Dr. Jakandu Directorate of Health and Family Welfare de gushi thakibo apnar khan ladu Central Health Services so central government employee ho jese
under Ministry of Health and Family Welfare
Health and Family Welfare acha aro post indu kote transfer khan hobo niki
we all over India transfer only mon bi ase I was like I said mo Delhi thakise aro yate jese so of course as a central government employee I can be transferred anywhere
acha doctor pensioners khan karne bishi koi dise services kan ase koise to pensioners babise gulu senior citizens kan na itu khan babna da he to itu khan karne kiba services নহলে benefits ase na nai
benefits bishi ase moan la to yade small center but if you go to metros takanuni bishi benefits ase senior citizens kanim dito tana queue ikudinu boibo they have a different queue and they are given preference in the queue also they can first I will laga and impanel hospital jaidem diwe muila referral bin lagi if they are 75 and above they can go directly to the hospital without any referral also inia kana say and beyond that also in other metros where there's enough staff other pensioners even common public also aigina when monla wellness center they can come and get treatment also and consultation from us not treatment sorry consultation from us
doctor bimar kwadu kitia hobo na jane to apnar wellness center to 7:30 to 2 khula ase to itu time working time in den hoy kina itu la more বেশি মিডনাইট তে বিমার হৈছে ইদুলা টাইম পিছে দে বিমার হৈছে তো না হৈছে গুলো দুসরা হসপিটাল দে যাবলে পারু না না পারবো
বেশি বর্ন কোশ্চেন তা হলি আপনি বা I get this question very often emergency situation like I said 7:30 to 2 mando itu time de jeto bon hoy jay to patient bimar hoishikali to not only after that time also even during that time also when we are open khulina ta khatam de patient emergency asiklo to they can any hospital jawole parebo for treatment any hospital only be if they have to go for reimbursement they can emergency certificate ekta lobole lage from the treating hospital or the treating doctor that this was the emergency for which he was admitted or treated for and that's why he was treated here in this hospital it will emergency certificate is sufficient for everything
itu aro apna la wellness center da nekin hai administration
itu if it's serving takana nijor office te jabo pensioners as golo mon aibo medicines can if there are some medicines there if they have to prescribe we'll give the medicines from our wellness center it was
eta moi bishi bhabi aso moi bi UPSC exam digina pass hoise golo kiman bal hobo bhabi ase central government employee hoi jabo to itu la card moi bi thakibo moi bi beneficiary hoi jabo na to hoili bi bimar manu tu bahar hospital empanel hospital de jaigine treatment kurise to paisa tu cash tu digdar to cash dibo na free dibo pabo tate
yati duita category ase ekta to serving laga lop alag ase pensioners nim dia laga ase pensioners la first ko dibo pensioners kanene very good everything is cashless they don't have to pay anything only the referral slip lage and this is not only for treatment investigations can be na blood test khan kura MRI CT scan everything is cashless they don't have to pay the impanel hospital our office will take care of everything they just need a referral serving nimti to they get the same referral but tehan payment to kuru lagi, which is reimbursed by their office. But
Acha.
very good thing, it's very cheap.
Oh.
Very, very cheap. The rates are very low. So even if you spend to la pocket per spend kori, man spend no kore.
Acha.
And everything is reimbursed at CGHS rate. So if you go to an impanel hospital, if you pay CGHS rate, you'll get everything back.
अच्छा चलो पेंशनर्स खान करने तो किमा बाल
बिशी बाला से
कैशलेस हो जैसे ना अच्छा डॉक्टर सपोज बेनिफिशियरी एक तादु कोई मादे बेनिफिट्स लो ऐसे कार्ड पाइगने ऐसे CGHS लगा ना तो ताइदु इतना ट्रांसफर हो बोला ऐसे ट्रांसफर हो किने लेट्स से दिल्ली है सबसे खुशी पाने के दिल्ली दे जैसे तो दिल्ली जैसे वो लोग की कुरू बोला लगे
अच्छा
so that it will benefits
to continue ko lagi moi serving la koi dibo to because serving khanto card to pagina if you are transferred to a CGHS covered city like I said 77 plus CGHS covered city ase eta ekta transfer koishili to online card to transfer kore there's a procedure to do it we have it in our website how to transfer it holibi we transfer the card online very easy our out the Newton city designer they'll accept it online only
Achha.
then the same services will continue in Delhi also
अच्छा
in Ingase
so की कोई seamless
yes seamless
transfer
yes,
हो जैसे
yeah.
ना अच्छा डॉक्टर किमान भी खुशी पाए से आपने आई कि ने मोर निस्ना मानु मोर खान दूरदर्शन लगा viewers खान सब के central government health scheme लगा प्रोग्राम की चुलिया से की बेनिफिट्स पाए से इदु मोहन के सब के जनाई दिया करने और होए मोहन सेंट्रल गवर्नमेंट सर्वेंट्स का भी विषय है तो होले भी खबर ना जाने की ना था कि जो ले आज ही इतु डिस्कशन दे दूरदर्शन लगा व्यूअर्स का बड़ा जाने की ना और शेयर करूँ भी दे शेयर करूँ ना खबर तो शेयर करूँ ना जाए था कि जो ले तो और काम भी विषय होले पड़े होले भी
oh that's it's my pleasure to help them out
डॉक्टर मैं अपना ला वेबसाइट ते चेक करी थका दम दे अपना सर्विसेज कान एलोपैथी होमियोपैथी और इंडियन सिस्टम ऑफ मेडिसिन कान इदु कान कोई थकी से इत्या मोहन कोहिमा वेलनेस सेंटर दिदु इंडियन सिस्टम ऑफ मेडिसिन कान पास ना एलोपैथी क्लास है
इतना तक तो मोहन एलोपैथी আছে unfortunately मोहन इतना तक पे होमियोपैथी आयुर्वेदिक कान इट वांट टू आनाई proposal तो था कि भी unfortunately मोहन we are not included in that proposal but I hope that we are trying for it that allopathy ayurvedic or homeopathy भी start करली let's hope for the best
अच्छा हो सा से और डॉक्टर थैंक यू सो मच for your time और आहे कि ने मान डिटेल बड़ा कोथा कोई दिया इतिया इतु अकला न कि ना दूसरा हेल्थ कॉम्प्लिकेशंस प्रॉब्लम्स का भी विषय था कि फ्यूचर दे भी मोरम बड़ा दूरदर्शन के टाइम दिगना है कि ना मोहन व्यूअर्स खान मोहन सब के health matters kan de mohan la top form program de agina koi divide guine advanced request bi di dia
oh it will be my pleasure
yes and dear viewers mohan central government health scheme azi discussion kurise Dr. Nungsang Temjan CMO CGHS Kohima bra agina mohan ge balbra information di dise aro itunisna mohan top form de itu दूरदर्शन program de aro health program kan ahi thakibo morom bra tune in kurigine sai thakibi aji karne yete bra ses kurubo bye